Welcome back to the Hampton Roads Show. I'm sure you've seen all the pink ribbons and accessories this month. It's a good opportunity to think about what goes into breast cancer treatment.
October is Breast Cancer Awareness Month. Why is that so important in today's world?
Well, personally, in my own family, we have the breast cancer gene. And so that's a gene that causes breast cancer. And I've got relatives where every young woman has had breast cancer after age 18. So why is it important? People need to get screened. They need to be treated if they do have cancer, and screening saves lives.
It's a very common disease.
It is a very common disease. About 1 in 8 women have breast cancer. Only about 10% of that's genetic. So many people have breast cancer just because it's very common in industrial societies. It may not always be genetic, but it's important to look for if it's genetic, because if someone has the gene, it's important to do different screening in their family members, their daughters, their sisters, because finding it early can save lives.
Dr. Krueger, early detection is key in the fight against breast cancer. You have so many great tools at your disposal.
Yeah, we're very fortunate. First of all, a new kind of mammogram that's only been in the Hampton Roads area for about a year, and it's called tomosynthesis. And basically it's a 3-dimensional mammogram. If you think of doing a mammogram, and many women have been through it, you take your breast, you compress it, and you take pictures of the breast from the front and from the side. Well, the problem with that is many younger women have very dense breasts, and you can't really see the inner portions of the breast that well. And what tomosynthesis does is it adds about 6 seconds to the mammogram. And when they do the mammogram, the arm of the machine sweeps across the breast and it creates a 3D picture. So it's almost like slicing the breast up into small pieces of like a sandwich. And you're looking at each individual slice so that you can see the inside of the breast better. And that's clearly been shown to pick up more cancers. And even in the healthy patient, what's great about it is it decreases the callbacks. About 54% of people don't have to come back for other views, because when you get the slices, you can see that everything is fine. You don't have to do excess biopsies. You don't have to do other views. But for the person who might have cancer, it increases the detection rate of cancer by about 55%.
Once a patient is diagnosed with breast cancer, how important does the team become?
That's absolutely true, and we're very fortunate in the Hampton Roads community. We have something called a tumor board. And what tumor board is after someone's been diagnosed with breast cancer, a group of doctors, both surgeons, radiation oncologists, medical oncologists, plastic surgery people, genetics people, pathologists, we review everything. And so a treatment plan is developed for that patient in real time. And once that treatment plan happens, we decide, do we start with chemotherapy? Do we start with surgery? And then we follow that patient through the course of their treatment and continue to make all the decisions for their treatment so that everyone's input can happen.
Dr. Krueger, it is Breast Cancer Awareness Month. What do you want every woman out there to be doing today?
What I would like all women to know is monthly self-breast exam. And if for some reason you don't have insurance, you can't get a mammogram, it's available. There's lots of free mammograms that are available through the Every Woman's Life program and other programs in the peninsula. So get your screening so that, God forbid, if you have a problem, we can save your life.
Thank you, Dr. Krueger. Dr. Scott Krueger is with Virginia Oncology Associates, 40 board-certified physicians in 12 locations across Hampton Roads. To find the location nearest you, visit virginiacancer.com.